Okay, so welcome back to our channel. We're going to continue with our podcast, and it's really exciting. Everything is progressing really well. I'm Dhalia Masud, I'm one of the plastic surgeons.
I'm Rachel, practice manager here.
So today we're going to be talking about, I think, another interesting topic, and that is people's expectation of surgery. We're just going to start off with is what people expect when it comes to a facelift or they come to me and they just want a one-off treatment and that will be it.
Yeah.
They will be done forever. It will be
One
one
and done.
surgery and that. And in reality, that's not quite the case. Now, what did you think about facelifts before you came to see us?
I just assumed you would have one facelift.
Yeah.
And that will see through your days.
Yeah.
And to probably have it around 50, 60.
Yeah.
But that's not actually true, is it?
No. Well,
Ish.
it's kind but it's kind of true. But did you have a similar sort of?
I did. Before being in this line of work, I would have just imagined you would go and see someone, have the op, that's it.
Yeah.
Didn't really think there would be any more to it.
No, that's because when you look at someone's face, the reason why they look mature or older is not because of one thing. It's usually a combination of skin quality going down, facial structure going down, muscles relaxing, losing the volume. And a facelift is just a facelift. It's exactly that. It lifts the skin and it lifts the muscle, but it doesn't address all the other issues. And all the other issues, such as maintaining your skin, is, again, surgery can't treat it. You need to do lots of other things.
For the quality.
Exactly. And one of the things that we start recommending are the basic things, such as retinoic acid, the LED light therapy, and that helps rejuvenate the skin. And we need to maintain that afterwards. So it's a long-term thing.
We are becoming more aware of it. Like even things like the LED wasn't something that was on anyone's radar before, was it?
No. And one of the things is when people come to see me, if you just do your skin quality and if you do your LED, a lot of people are just happy with the responses of that. So you could actually potentially say, come to see me for a facelift and we do all this other stuff and do 1 or 2 local anesthetic procedures and you've avoided a facelift because you're satisfied.
You discover it was the quality that you were unhappy with in the first place.
Yeah.
I want to put off having a facelift for as long as possible.
Yeah.
So I'm now investing in my skin with the red light, using all the serums. I think I have every serum you could probably now buy because of you.
Yeah.
So I just want to try and do Tweakments.
Yeah.
To try and avoid. I mean, ideally, I prefer not to have a facelift. If I could do Tweakment, then that would be great. But it is an investment because you're going to have to keep. You can't just start it. You need to keep going.
Yeah.
Long term.
And then when you do have a facelift, you need to maintain your skin afterwards and have, like you say, treatments afterwards. And it might be another little bit of a skin lift 2-3 years down the line. So that is something that's really important that patients need to be aware of. So it isn't just a one-off surgical procedure. And that's true of tummy tucks,
boob jobs,
everything needs maintaining.
Well, yeah, because even when you've had a surgery, your body will continue to change anyway because of the aging process, don't it?
Yeah.
And your skin does change when you're older. Like you get the jowls, don't you?
And everything affects it as well. Diet, what your lifestyle is doing and what your environment is as well.
Yeah. And we've got superstars that have amazing surgery, such as the Kris Jenner.
She does look good though.
She does look good. But that's the thing. People think she's only had one surgery.
Yeah.
She hasn't. She's had lots of stuff before. She's had the surgery and she's probably having loads of stuff, probably on a weekly, if not a daily basis. And then she's had really good photography and a really good team around her.
Yeah.
It would
misleading in a way then, isn't it? Because that is given the impression it's the quick fix, the one step. because we're not made aware of or what she might be doing every week. But I agree with the whole looking after your skin on a daily basis, the products and the LED.
And what frustrates me is that people think that it's a one-off procedure. It's because people don't talk about the treatments that they've had. People won't talk about they've had a facelift. And yeah, exactly. I think there's a stigma. People like Lindsay Lohan, all these famous people, they've had lots of stuff done, but they'll say, I've had nothing done.
But equally, they probably don't want their friends knowing because they don't want them to. They now feel really good and look really good. They're like, I'm not telling you.
So when their friends say, you look amazing, it's just thanks.
Thanks. Yeah, I'm not going to give you my surgeon's name.
Why do you think people don't want to tell other people what kind of surgery they've had?
Judgy.
It is judgy. Why are people judgy, do you think?
Because they are, and not everybody's judgy. I actually don't care if my friends have any work done. We're all quite honest, but I think there is a stigma, especially in the older generation. They just get on with it, don't they? They don't tell anybody.
Do you think self-esteem comes into it as well?
I'm not sure.
Someone's felt unhappy with them, so they've had something done, but then they don't want to acknowledge that because it's almost acknowledging that they had a low self-esteem to lead to that being done, or do you think it sort of becomes an emotional thing?
No. I'm such an oversharer. Yeah. So I'm quite happy to share.
If you've had, face, let's say breast, let's say if you choose to have breast surgery for cosmetic reasons,
I'd be showing everyone.
Would you?
Well, I had my eyes done, didn't I? And I was very excited. I didn't make any secret of it.
But do you
there
think
would be areas of the body that that clearly you might not want to share?
Yeah.
If it's dealing with sort of intimate areas, I think.
What about? Do you think people would share face stuff?
I think more so.
I would.
Botox, because I have patients that come in and they say, "Oh, I've never had anything done, and I'm a plastic surgeon." And they've obviously had fillers, and they've obviously had Botox. And I don't understand why they won't say that to me.
Is it though? Because they don't see that as having anything done?
I ask them directly.
Okay.
Botox
and they say
non-surgical treatment. And they're sitting there with Botox.
With no expression.
Wrinkles and lips that you would not expect in that kind of skin.
So do you think somehow people put shame associated with having things done? And
I think so. I don't know if it's shame or if it's the pressure to look natural and be natural is sometimes overwhelms people.
There are a lot of pressures for women. I like I say, I'm an oversharer, so I don't hold anything back to a point.
Yeah.
But yeah, I think maybe some people just are quite in themselves to not want to tell everybody. Because people do have an opinion of it.
Is there a difference in the generations, you think, in age brackets, those that share and those that don't? Or?
I don't know. I think it's everybody is kind of conservative about how they present themselves and what they've had done. We were talking about there was Ariana Grande. She apparently has had nothing done.
Okay.
And I think that's more harmful because you have young people growing up thinking she looks the way she does because she's natural and that's just the way it is, and it makes them look bad. And they have unrealistic body shapes, body figures, skin color quality, skin tone, and then they feel bad about themselves because they don't naturally look like that. And
I think for the younger generation, it's really hard. I mean, it was hard when we were growing up, but I think now it's all filters, isn't it? It's no one actually looks like that. AI people now that you think are not like real, they're not.
Yeah.
Yeah, because at one time nobody even knew about all the airbrushing with pictures, did they?
No.
So the magazine, certainly when I was young, what you saw in a magazine, you believed that was it as it was.
Yeah, but they were airbrushed as well. In fact, airbrushing and making yourself slimmer, there's evidence to show that happened in the Victorian era as well. So you know that these people who had really slim waists, they'd actually doctor those photos,
Right.
to make and draw in the waist to make it look thinner. So the concept of airbrushing and making yourself look different has always been there.
Okay.
So it's not a new thing.
Maybe that's why with the famous people, they had to follow on with surgery because you've got all these airbrushed photos.
Yeah.
But they've obviously still got to go around their life,
Yeah.
shopping and walking their dog or whatever they're doing. So actually,
Yeah, but that's
fair for them. The reality.
Yeah.
Look at these photos of me looked amazing. I now need to get myself to.
But
look
you would
like
see
that.
them in their natural habitat, is what they used to say, didn't they, in the press? And you'd see them and be like, wow, that person is not looking like they did
No.
24 hours prior.
Because then the press would cash in and say, oh, they've gone downhill.
Yeah.
Oh, what's wrong with this person? But actually, yeah, it's probably the airbrushed photos in the first place.
I think you'll always have the women that will happily share and the women that will never tell you the truth for whatever reason.
Does it make it difficult for you as a surgeon if
It
you're
does-
not getting transparency?
Absolutely. You know, I mean, I sometimes know
Yeah.
that they've had it done, but if you go into surgery and they've told you they've never had anything done, the surgical technique and the amount of dissection you do is very different
Yeah.
to if you operate on someone that's had lots of things done. You have a very different approach. And it does completely change the approach. It's happened to me twice, both in my very early years where I believed my patient and they told me they'd never had a neck lift before. And they had some kind of treatment. And when I went in there, it was all completely scarred.
Wow.
And the scarring that she had was apparently not from a previous.
But that's dangerous.
It is dangerous. But
They're putting their
people-
lives at danger with things like that.
People do. I
So
mean,
don't lie to your surgeon.
So yeah, for you
Yeah.
in a consultation,
Yeah.
honesty has to be there.
Yeah, it has to be there.
What
So
if
it's
something goes wrong? That's really dangerous.
Exactly.
And
It's
you
very
need to allow a lot more time on
You
the
need to
surgery
allow-
as well, wouldn't you?
Yeah, you can't do a full.
That's why you're like, what's this scar?
Yeah.
What's this scar? When you're
Yeah, I have to ask every single scar just because it all determines what I'm going to do.
And did you ever get to the motive of why they've not been honest? Like coming around to what was disgusting, really, this whole hiding thing.
Yeah.
or is it deny? They come
Deny.
around and go, I don't know what you're talking
I
about.
don't know what you're talking about. I did a rhinoplasty a few years back on someone who told me that they'd never had fillers before and it was all stuck with fillers. And the excuse was they had a fall. And that was a few years ago. So it's, you know that if people aren't going to tell you, they're not going to tell you. You've just got
No.
to spot them from beforehand. which
That's
is
weird. I find that
frustrating.
really weird,
But
especially to a medical
I was
professional.
gonna say,
I'd be
it's just-
scared.
But why? Yeah, why are they not saying it to you,
Yeah.
even if not to family and friends?
Yeah.
I think they say it for cost, maybe, because if a revision rhinoplasty or a revision facelift is a lot more expensive.
Yeah, obviously, because there's a lot more work.
Yeah.
But I'd be handing a bill after that going, I know you had surgery. Here is my new.
Yeah.
Do you do that or not? You can't do that.
I did it on those two cases.
I would. She will be doing that for future. If not, we will take the new nose off and put your old one back on. Yeah.
So
Dangerous. I just don't think I wouldn't be able to do that.
So, do you think people's expectations around all this are very different from reality as well?
absolutely, yeah. What people think what a facelift does or what a tummy tuck does and what the reality is are two different things. And what people do is they look at social media and they think they're going to have that tummy or they're going to have
Yeah.
those breasts, but they don't compare themselves to the before
Yeah.
pictures, So those patients that look great on social media, A, it's all been Photoshop, but B, they looked not bad or great before the surgery. So
quality,
skin quality is different and you have to work with what you've got. So if you started off with good quality skin and fairly slim anyway, you're going to get an improvement on it. But if you were never in that position in the first place, you're not going to look like that afterwards. And that's what people sometimes struggle to understand.
Can you have 2 facelifts?
Yeah.
So you can go in and have another
So
one done.
you can have whatever you want, but each one involves more risk.
Okay.
So your face has lots of different layers, and they glide against each other for correct movement. And when you do surgery, those layers get stuck down.
Okay.
So when you go back in, releasing those layers become more difficult and more dangerous because the nerves get intertwined in those layers.
Stuck within.
So it gets stuck within them. So you have to be super careful of this thing when you go in. So I never operate on anyone until, if I do need to do a little bit of a revision or a little bit of a tweak, I have to wait at least a year for the swelling to go down.
Okay.
But a facelift should last between 8 to 15 years. A full facelift, not a full facelift. But they have to maintain their skin quality in between.
So another question. Is it like Priscilla Presley or some of these ones whose faces are very disfigured now? They don't look like the same. They look very swollen and bloated in the face. They've obviously had a facelift. What's happened? Because that shouldn't look...
Is it the fillers when you were saying the last one about the scarring?
It's a combination of everything. So what happens is you have to have harmonious face. And when you just focus on one bit, let's say you've got a wrinkle here and you're underfilled here, which I have a little bit. If I just fill that area up and not think about what's happening to my forehead, my lips, my nose, it just looks, the harmony is off.
Okay.
So with faces like that, it's a combination of a lot of scarring. The surgeons have, or the people that have done them, I'm not saying they're surgeons, have just focused on one area and forgotten about the harmony of the rest of the face.
Okay.
So sometimes you can, one of the things that's in vogue at the moment is focusing on the jawline. So you can focus on giving someone a jawline, but if giving someone a jawline, making them square, you can make them bigger. So yes, if you put a close-up picture of that jawline, it's nice and square and tight. But if you look at their whole face, it's completely out of sync of the rest of the face. Because
there's a lot of fillers now being used to create these jawlines and reduce gels. Am I right in saying that? Yeah. So you get like a really almost square.
Well, we don't.
No, I'm not here. Yeah. But I've seen a lot of these recently where they have this really chiseled jawline. How?
Yeah, people like that at the moment. Chiseled jaw. I think it looks good. Anything, it looks good as long as it's in harmony with the rest of the face.
Yeah.
But you're in danger of getting a pear-shaped face.
Yeah, if you don't think about the whole face, it will look scary. It will look quite machinery or off-kill. But if you do it and accept you're not going to have a chiseled jaw, you need to have less of a chiseled jaw to match the rest of your face.
Yeah.
And it looks quite good. You just got to go to the right people.
So the ones that have got these kind of faces, is that, could they ever go back and get it sorted out?
It's going to be really difficult.
As I say, because you would think with all the money that they have that they would try and...
Yeah. Sometimes the damage is done and it's permanent, and a surgeon, if someone came if someone's had multiple surgeries somewhere else and they look that disfigured, right, the best thing to do is not do anything, because the more you go in, the more scar you produce,
right?
The more damage you can do, the more nerve damage. So the best thing is just not do anything and potentially just dissolve some fillers that's left over. But we know that the fillers cause a scar reaction. So even if you attempt to dissolve the fillers, the scar reaction is never going to go away. So the more you do, the more damage you create. So
it's also knowing when to stop.
Yeah.
Isn't it?
And most reputable surgeons will just say, I'm sorry, I can't do anything.
No.
I'm going to cause more damage than good. Yeah. And a lot of surgeons are saying that now. If you've had multiple fillers and it's all very scarred, they'll just say, I'm sorry, you're not a suitable candidate for a facelift at this point.
That can be difficult, actually, saying.
Yeah.
When someone's got these ideas and then you're turning them away.
Yeah.
They don't receive that.
They don't receive that.
always
We've
very
turned
well,
quite
do
a
they?
few away, haven't we? And they don't. It doesn't go down very well. But
Yeah.
sometimes doing nothing is the best thing for
Yeah.
them. It's
A question I get asked as well is a lot of people are afraid of a general anaesthetic. So with regards to facial rejuvenation, they don't have to always have a general, do they?
it depends how much they need and what approach they take. So if you have facial rejuvenation, you can, providing you're fit and healthy, you can have everything done in one go. So that's the upper eyes, lower eyes, full facelift, neck lift. You can have all of that done under general anaesthetic.
Yeah.
I was going to
General,
say,
but-
But that has a lot of downtime. It's a
Yeah.
lot of expense in one go.
but that's
and
why
it's
I'd want to do it though.
a big change in one go, psychologically as well as physically. But there are some people who don't want the general anaesthetic, because they're unfit. You know, they've got lots of comorbidities and they're on blood thinners. So what you can do with patients like that is split up the procedure. And sometimes when you split it up, you stop a lot earlier than if you'd had a full facelift. So you just
Yeah.
have your eyes. Yeah.
And this is with local then, isn't
Yeah.
it? So for those that are afraid of a general.
Yeah.
So there are things they can have done.
Yeah, so you can have eyes done. You can have if it's just want to focus on the gel and they're at the appropriate age, we can do a mini facelift on the gel.
I think I would rather do minis than if I was. Yeah, I don't think I would. I'm not wanting to have a facelift.
Yeah, I mean,
I think it's-
I still can help it. In like 20 years, they might change your mind. But I don't. I would.
think-
I'd rather do small bits.
Yeah, small under local. So not everyone realises that's available. So that's really good. But we really do encourage the skin quality first, don't we?
Yeah,
Including.
absolutely. Yeah.
And I think as well, sometimes we just have to accept that we are not going to be looking like we were in our 20s.
Absolutely.
And I think that is the biggest thing to get your head round. Because I think as well, when you're in your 20s, everything is different. Your body, if I fall over, I really hurt myself now. Whereas if I fell over in my 20s, I wouldn't even care. But now everything, healing is slower. And you just have to think you're not going to be looking 20 even with your facelift or even 30s. Just going to be a better version of what you already have. That is the biggest mind that messes with me even now.
Yeah.
Never going to look like that.
Yeah, so enjoy what you look like today. 'Cause
Yeah.
you're going to look like
It's hard to
tomorrow.
adapt, actually. The aging process can feel very unkind. Because
Yes.
you do want to look how you looked, but you have to accept that that isn't how it's going to be.
No, because in my
Your
head, I
skin
still feel like
quality
I'm
and-
quite young, but I'm
It's
not.
fine. You feel the same.
Yeah.
You feel that same person and you look in the mirror and think,
Who
when
is
did
that?
happen? Exactly.
When do you think you look the best?
I think I really enjoyed my 30s and 40s, actually, because when you're young, 20s, I still think you've got what you described from it.
Yeah.
Subcutaneous.
Yeah.
And you might not have such a sculpted look. And for me, it was 30s and 40s. Then you get into 50s and you really do start to notice a change.
I'm not great.
Yeah, so-
What are the positive things about the way you feel about yourself and the way you look?
I think though in many ways personally, you sort of become a bit less bothered as well.
Yeah.
Because you almost get a bit of a peace in that, I'm in this age bracket now, so it's okay. It's almost some of the pressure goes, I think.
You look
feel
really
that
good,
way
though.
Yeah, you
anyway.
do. I know.
I know. If you didn't look as good, you may not feel that way. You look hot.
I can only speak
Yeah.
how I feel, yeah. Well,
When
when
were
I
you most
think about my
confident?
daughter, I can give you an example.
Yeah.
She'll kill me. But, she's
Yeah.
going on her holiday. She's
Yeah.
in her 20s. So all the outfits have got to be perfect. And, she's showing me, and it's sort of self-criticism of how she might look in certain ways. Whereas now, if I'm going on holiday, that's I don't even really think about
Right.
it. I don't have all those self-criticisms. I just accept Well, I'm in a one-piece swimsuit now. I'm not going to do
I
it
love a
completely
one
again.
piece.
I've always been in a one.
So
Yeah,
I don't put that pressure on myself anymore.
Oh, that's
Oh,
good.
to be young in 20s.
Is that your favourite decade?
I would actually say I was my most happiest when I was about early 30s.
Yeah, 30s are amazing.
I had my body was good. I'd had, children, everything had bounced back. My skin had never looked better. Got to
But
the
would
end
you-
of the
would you-
30s.
Would you have felt, if I asked you that question in your 30s, would you have said that? And
I probably would have, yeah, because I think in my 20s, I found my 20s quite hard.
Yeah,
With juggling work life and body image and now I've had kids. I'm like, what did I do?
Yeah.
What did I do in my spare time?
Actually, none of that pressure was there.
No.
For me in my 20s. I remember where I lived, there was literally just a Boots chemist, and they had maybe one makeup counter. But there wasn't all of the products. There was no social media. There was none of the products that are there. So I actually have escaped the pressure in my younger years.
Yeah, we just saw a little snippet. It was nice to grow up with no phones, and you could go out and do whatever you want, and no one knows. There's no trace.
Yeah.
So it's very different.
Do you think the social media is making you feel? Because if there was no social media in your 30s and in your 40s,
Yeah.
and you felt confident then, now you don't have that level of confidence. Do you think it's social media, or is it?
I think in your 30s, you do care a bit. You don't say no. I feel like in my 40s, if I don't want to do it, it's going to be a no, and I don't need to give you a reason. Probably in your 50s, it's like, I don't actually ever want to talk to you again. We're not doing that. So I feel like
you can give the reason.
no, you just go through. I've never been a people pleaser, but you'd always try and, okay, we'll do it. I don't really want to do it, but we'll do it. Whereas now it's going to be a no.
Okay.
So I feel I've changed for the better in that respect.
Do you think you make more of a physical effort to go out now?
No.
No.
I go out with no makeup now.
Yeah.
I mean, on the school runs, I look like a complete troll, and I actually don't care. Whereas before, although I think I've always been a bit like I don't care to a point.
That's good, isn't it?
But I would feel more insecure when I was in my 20s. I would definitely have had makeup all the time, but now I don't bother as much. Equally, I think your skin changes. So the makeup I probably wore in my 20s, I can't wear that.
No.
I can't wear a foundation because it will just sit. And I think that's another thing with women. Beauty has evolved. We don't have like Millie, my daughter, will say, "You're doing your makeup completely wrong." I'm like, what do you mean? She's like, well, no, you don't do it like that. So they have their own little way of doing stuff. So I feel our makeup actually ages us a bit now, because we're still doing what we did back then, and it's evolved and changed, and just like fashion changes.
Yeah.
That changed. I remember you used to have square nails with really thick white tips. I looked back on my wedding.
Yeah.
What was that all about? That was a vibe. Who's got square nails? Somebody might, and they're equally still really lovely. But I mean, it's just changed now. We're more natural.
Although that just demonstrates the influence of media.
It does.
That's-
Yeah, that's
that's-
true. It does. Yeah.
I was never allowed to wear makeup.
Well, you're not.
No. In school, and if I had makeup on, I had to wipe it off.
Did you have it on the bus? Did you get the bus to school?
And then my parents drove me. They
I walked her in by hand.
Yeah.
Because she's such a trouble.
I was never, and because I was never allowed makeup, it wasn't what there were lots of other fights I needed to fight, and that wasn't the fight that I could be bothered with, and that's why I never bothered with makeup.
But you don't really wear makeup now.
So one of the no, I don't wear makeup. No. One of the things that my mum always said is take care of the quality of your skin.
Yeah.
Because if you take care of the quality of your skin, you won't need makeup. So that was her reason for me not wearing makeup. And now I prefer my sleep than waking up in the morning to put my makeup in.
So as a surgeon's perspective, though, it's hereditary as well, isn't it? The
Absolutely.
quality of
The
skin.
quality
This is
of
not
skin.
just what you've done.
No, it's what there's a massive genetic component to it, skin exposure, and maintenance is really important, but there is a massive genetic component to it. People just naturally have good skin, and other people
smoking
don't.
has a huge detrimental effect.
Drinking does as well.
Smoking, drinking.
So people's
Skin
past lives can
exposure.
catch up
So
with them
enjoy that in your
tomorrow,
early
you know.
20s,
Yeah.
because then when you get older, you're not going to be able to do any of that.
Well, you can still do it. It's the effects of the stuff in the young generation that's affecting them in the 60s. So
How is that though? Is that the cell damage or
Yeah,
the mitochondria?
it's the cell. It's the
process?
cumulative cellular damage by the sun and by what you eat. It just affects you in 20 years' time.
So smoking and alcohol, does that almost cause a scarring in the skin? Or
So what that does, it prevents healing or
Right.
repair. So smoking has got nicotine in it, and that nicotine causes contraction of the blood vessels. So when you contract the blood vessels contain all the nutrients for the toxins to go away and the healing to take place. So if you cut yourself, if you're a smoker, you've got a higher risk of infection or delayed healing. And also it affects your collagen level in your skin. So the collagen helps your skin bounce back, the elastin helps your skin bounce back and maintain its structure. And if you smoke, they don't work properly. So you look a lot older and you get those smokers' lines on your face.
And
They are my biggest fear.
Rectify that.
That's a really good
well.
point. A facelift won't improve that at all. That has to be a change. It will lift the face, but it's not going to improve the quality.
So that will be non-surgical intervention.
That being non-surgical. Number one, stop smoking. But non-surgical.
Is that when you put fat in that bit?
Yeah, so you can put fat out or peel.
That is such an aging thing, the mouth, isn't it?
But we don't operate on smokers either, do we?
No, they have
You
to
do
be.
have to refrain
You have to refrain from smoking
because of the healing.
So the aging process catches up with us.
We think we're invincible when we're young.
Yeah.
Then it can be a shock for people actually to see the end result maybe.
And it's never going to be one and done. You're never going to be done. You're going to have to maintain the rest of your life.
Yeah.
So look after your skin now.
Yeah.
And then you might be able to avoid having full-on facelifts. Just a few little tweakments.
Yeah.
Because how much, like a facelift is expensive. Whereas if you have little bits under local, is it local?
Yeah, local anesthetic.
It's a hell of a lot cheaper.
It's cheap.
I've only got a few years left. And then it's going to go nosedive.
You just got to...
No, because you're already doing the LED masks and lovely products.
But menopause will start taking effect on my face.
It takes effect on everyone's face.
Great.
Yeah. But I quite like
I look like
that
a rabbit in headlights. What?
I am now that I'm seeing more patients, I'm actually appreciating the more mature look. I actually now find it more attractive. I don't fear wrinkles or sagging face.
Well, I'm already there and I'm living with it.
Not willing to do that just yet.
I don't, it doesn't bother me. And I think even with...
That's because you could fix your own face.
I probably wouldn't. I mean, I might have some tweakments, but I don't think I would be that bothered by it. Just because I know it's such a hard...
Some adjusting.
Yeah.
As a mature woman, you definitely do look in the mirror and think, oh, that's such a change.
Mm.
And because you feel like the same person inside, it sort of can't put the two together in a way because you just feel like that 20-year-old inside. But yeah, I think for the most part, I'm enjoying the process, really.
Yeah. You're not going to enjoy it?
No.
But how do you feel now?
No, I feel great now.
Yeah.
I feel great now, but I'm early 40s.
Yeah.
But I won't have filler, but I'm all about PRP, Botox, whatever I can put into my skin naturally. I'm not, 100%. I'll be a guinea pig, no worries. Yeah. Yes, we are not aging.
Yeah, I think I'm coming to terms with it. Yeah. I don't mind it.
It's because your skin looks great.
But even if it starts to get wrinkly more. I think I don't really know.
I'm not ready. I'm not ready for
Many
it.
people go to their grave looking like 20-year-olds. I'm talking elderly people.
Yeah.
There will be change.
Yeah.
I don't know. Will there? Look at 20 years ago. No one was looking like we are now.
Yeah, we are generally looking.
We're looking younger.
and younger and younger.
You remember the Golden Girls?
Yeah.
They were my age.
Really?
Yes.
Wow.
I am not doing it. Not doing it. I'm not doing it.
Yeah, maybe I am disillusioned then, because that is quite.
Yeah.
Revisit in 10 years.
Yeah,
time, shall we?
yeah.
Is it intense?
I think hairstyle and clothes are dated then,
Mm.
or to what we now look back and
Yeah.
think of as the old person's look. So I think that's the thing we've changed a lot as well.
Yeah.
Because I remember, funny enough, doing a job years and years ago, this lady who was the manager there said, people at my age, so at that age, I was in my 20s, oh, you shouldn't have long hair. Long hair is for young girls.
Oh, really?
100%. I've heard that.
Yeah. So
Yeah.
it was almost, once you were classed as a woman, you had to have a short back and side haircut. But
Yeah.
that aimed people, didn't it?
Oh.
But yeah, the opinion was, only young girls had long hair.
That I
Whereas
remember
now
that.
it's when I'm in
That
my
is a thing.
50s, but I don't have any intention of not having
If
long
I
hair.
had short hair, I mean, I've only ever done it once. I would
think
never do it again. No,
A nice little pixie cut.
no. I will show you those photos of when I had a pixie cut.
Why do you not think of
Because I think it makes me look shorter. I don't know why.
I think it'll make you look like a little boy.
I just don't have the face shape for that.
The mixture of second.
Yeah. Bloke.
Because I would look like a boy, I think.
I just don't have the facial structure
If
for
I did
it.
it now, I would look old. I think that's how I feel. I've gone past the point of being able to do a pixie cut.
Yeah.
I mean, you got to have some strong
Yeah.
facial.
Depends what kind of. Yeah. Okay.
Yeah, no, I did that whole Cameron Diaz look in the 90s where it was all flicked
Yeah.
and really short.
Well,
It was not a look I want to revisit. Definitely not.
right. So, any final thoughts?
I sort of forgot what we were. Because we covered so much.
We covered face.
I have got one.
Final thought, yeah.
Final thought, it's not one and done. You are going to
yeah.
need to maintain. It is not. You shouldn't neglect your
Yeah.
skin and expect for really a miracle if you're going to have a facelift.
Yeah.
Because the
Yeah.
damage is already there. Your skin needs to be looked after.
Yeah, so expect the journey to be a multifaceted thing.
Yeah.
Yeah.
It's a lifestyle. That's what it is.
Great. Okay. So, that's it for today.
Right.
And then hopefully we'll see you again. If you have any questions or if you want us to cover another topic, put it in the thing below. Give us the topic and we'll have a chat. Bye.
That was a good one.
Hmm.
I think that was quite, I think people will like that
Awesome.
one.